I'm going to do the Facebook discussion again.
Yeah. So it's not overrated.
Okay, we're good. You're out.
We're back live, and as I said, we are not Bob and Doug McKenzie, but our technician did work for the show, the Great White North. So that might ring a bell to you guys. And hopefully, with the storm, though, we're assuming that that's part of the problem. But what our Facebook Live conversation will be about today is we'll be focusing on pain management products that are available for our patients in our Bucks County Orthopedic DME store for various patient-specific diagnosis and items that we'll be able to use to provide to our patients who are having various issues.
Now, in addition to the products that you're about to see here today, we have a vast collection of different orthopedic braces and supports here in the office that can accommodate a number of different injuries and conditions, both acute as well as chronic in nature. Now, we have 2 full-time medical equipment specialists here at our 2 offices at Bucks County Orthopedic Specialists, and anything our physicians or our providers can dream up and think about, we usually can supply it here in the office, which is a great benefit and a great service that we offer here.
Well, you say dream up. I never would have dreamed up this one. I do like sci-fi movies, but what's going on today in reality has been a little bit scary, and we're all kind of quarantined at home now. Our office is still providing full office hours, although virtually we're seeing lots of various orthopedic troubles through computer. We are seeing at home, in the office, emergent and urgent care cases. So if you do have one, you give us a call, 215-348-7000. We'll get you in the office if it is an urgency or an emergency. But what I've been doing is 85% of my visits now, Bob, are on the computer. I'm doing telemedicine visits. I'm videoing. I'm actually having patient interaction and getting pretty good at it. And I think patients appreciate that service. But what's amazing is I'm developing aches and pains I've never had before. In fact, one of them, through using the computer, the charting has been excessive. I've had to take office notes and then type and type and type and work the video camera. I'm developing a pain in my thumb. And now you mentioned how our DME store has various products for people. I'm just curious if you can solve this problem for me. I've got a pain along the extensor surface of my thumb. It's really troubling me. I really can't seem to get my chart notes done without noticing my thumb.
Sure.
Who would think that a simple thing like my thumb could be slowing me down? You got anything for me?
Funny you should ask, John. I have the perfect brace for you. So I'm going to grab it here. It's actually called the Santa Barbara Thumb Brace. It's a very low profile, soft brace that's going to help support your thumb, especially when you're doing those telemedicine visits.
That's what I need.
And you're doing your chart notes because it allows full movement of your 4 fingers while helping support that thumb, which is most crucial, exactly how you described it. So, John, we'll try this on you here shortly, but let me demonstrate it for the folks out there. So with this particular thumb brace, there's 3 pockets. I don't know if it's hard to see in the camera image there, but in each of these 3 pockets, there's 2 little bars. So let me just remove them here. So we got a rigid bar and we have a springy bar. Now with all the bars in there, it just allows a ton of stability, as well as a little bit of movement, but not very much. Now we could put any combination that we want in here. So we could leave just 1 rigid bar in here, 1 springy bar in this other pocket, or both bars in the other one. Whatever's comfortable for the patients is generally what we recommend. So with this particular brace, so John, if you want to try it on.
I'd love to try it on, Bob.
Sure. Let's see where we're at here. So by putting this brace on, so we're just going to slip it right on John's thumb there.
That's easy enough.
And there's 2 Velcro straps. It's a piece of cake. So there's one here that just wraps right around his thumb. And it's just going to hold his thumb right in that pocket there. And then there's this nice long strap here that's going to wrap right around John's wrist. It's going to Velcro right there on the top of the hand. So again, very low profile, super easy. Anybody can do that.
I'll tell you what, Bob. Right away, I can sense there's an improvement because I can't move my thumb. That extensor tendon I mentioned to you over my metacarpal phalangeal joint is stable. Yet I've got full motion, 4 fingers, full wrist motion. I got absolutely no pain right now.
Okay.
What a great device. How did you know what I would want right out of the door here? This is fantastic.
I don't know. This is what I do all day, John, so it's pretty easy to kind of figure out.
I can tell you're an expert, Bob. This is fantastic. And in fact, because you're an expert, this is kind of a personal issue. I wasn't going to bring this up, but all these home telemedicine visits have really been playing a toll on my body. I used to think I was in pretty good shape. And these aches and pains I never realized before. So sitting at the computer for 6-8 hours a day, I realized I'm getting some back pain. I've never had back pain before. And the embarrassing part is my upper hamstring and gluteal muscles, they're sore. They're like bruised. Sitting all day. In fact, sitting here, I find myself posturing out of my chair to take some weight off my glute muscles.
I can see it.
This thumb thing's fantastic. Any chance you have something that might solve my gluteal dilemma?
You know, John, this really is your lucky day. You know, honestly, you should think about buying a lottery ticket because I have the perfect product.
Are the lottery stores still open? Bob?
They are still open.
Oh,
Absolutely.
fantastic.
I mean, state's got to make some money.
I hope they're open tonight so I can grab one if I'm that lucky.
So let me show you this. So this right here is called the Kabuti pillow. This is a Dr. Butler specialty who does our pain management here at Bucks County Orthopedic Specialists. So this Kabuti pillow, it's essentially a seat cushion, John. Pretty easy to use. It's just a matter of just sitting on the chair or car seat.
It just looks like a regular cushion. Is there a reason why this is better than a regular cushion?
So
I've been
why
trying
this
that at home, Bob.
Why this is a little bit better is there is a hollow circle right here in the middle. I know it's going to be hard for everybody to see there at home, but with this hollow circle here, when you actually sit on it, it's going to alleviate some of the pressure that's being put right on the lower end of your spine. So by doing that, it's going to help automatically correct your posture as soon as you sit on it. So when you're doing your chart notes and your telemedicine visits, John, I mean, this will really help you just keep you more upright in the chair, which is really what you're looking for, and a lot of us are looking for out there.
Would you mind if I tried that, Bob? Because it seems so simple. I don't know how this is going to work, but
Sure. John, why don't
I'd
you
love to
demonstrate
give it
for folks?
a little try. In fact, it seems easy to use. I just put it right
Just
here
matter
on
of
my
just putting it
chair.
in the chair. Exactly.
All right.
Don't make it any harder than it is.
Well, things seem to be so complicated nowadays, but let's give that a try for a little bit, Bob.
Yeah, we like simple, John.
I could definitely see myself
You're looking good.
typing and doing some videos.
You're more upright.
Yeah, I feel that. In fact, talking about videos and telemedicine, Bob, I've had a lot of patients calling about what they're doing because they're quarantined at home. They're doing various outdoor activities, spacing themselves, of course, socially, but taking that time to do a 1, maybe a 2-mile run. And a patient comes to mind I had last week, a telemedicine visit. I think he was 54 years old, a pharmaceutical executive. He's been home since March, and he was telling me that part of his issue was developing some activity-induced knee pain. He started a walking program. He's doing 2 to 3 miles a day, with or without his wife, and he's even tried to jog a little bit. And what he's noticed is he's beginning to have a little bit of knee discomfort. So without x-rays, without diagnostic images, we heard what he had to say, and I think it sounds like maybe just a simple tendonitis, activity-induced tendonitis. I wish I could just say in the office, hey, here's a little device we could give you. Do you have anything that might give a little knee compression, maybe promote a little energy, a little bit of resilience to his knee that might allow him to keep remaining active?
You know, I actually, too bad I wasn't over your house for that telemedicine visit because we would have been able to recommend what's called a Reparo knee sleeve. So I have one right here, John.
Are you kidding me?
It's right here.
Fantastic, Bob.
So this may look like your general run-of-the-mill knee sleeve, the neoprene ones that you typically see over the counter, whether it be at Walmart, Rite Aid, CVS. But this particular knee sleeve is a lot different, just based on how the fabric is made up. Now, it is a breathable material, but the fabric is made out of a semiconductor elements, which helps store body heat. So by storing body heat, what that does is it promotes the healing process of the body to go through the inflammation process, the repair process, as well as the recovery process. So it just allows the joint or the tissue that's hurt to kind of move through those stages of healing a little bit quicker by storing that body heat. And again, it's a breathable material. It's just a simple knee sleeve. A lot of our patients that wear this are not only wearing it during the day when they're doing activities, just like the patient that you had, John, but they're also able to wear it at night because our bodies do the best healing at nighttime. So if we're able to kind of help them through sleeping, it's just going to further promote the recovery process for their knee. Now, these repair sleeves come in ankles, wrists, leg sleeves, arm sleeves, but this is the knee here. And it's a very, very comfortable brace. And again, we've been having a lot of success here with the folks that actually have taken one with them.
It looks so lightweight and amazing how thin it is.
Mm-hmm.
I wish I had this last week, but what I'll probably do is I might reach out to him and tell him about this if we have it here at Bucks County Orthopedic Specialists.
That's a great idea.
And I'm sure there's a way that we can get it to him.
Mm-hmm.
You and I and the other providers here have been working pretty hand in hand, despite not having full office hours. We are able to make a suggestion,
mm-hmm.
make a brace suggestion, contact you, and then you're able to get in touch with the patients and get these products out to them, which has been really great for a lot of people.
Yeah, and it's based on whatever's easiest for the patient. If they're able to come into the office, great. I'll see them there just to be able to get them their product. But if it's just considering everything that's been going on, if they want the product shipped to their house and a Facebook or live video session with myself just to talk about that product, we've been doing that as well. So we can ship the product over.
Telemedicine visits through our DME store as well.
Sure, whatever.
That's a great idea.
Whatever we can to help.
Well, let me just interrupt you for a second.
Sure.
I'm sitting here, I'm listening to this great advice. I have no gluteal pain whatsoever. I feel like I'm sitting up straight. My posture feels better. This Kabuti pillow is fantastic.
Isn't it a game changer? It's a game changer.
And now I know why Dr. Butler, one of our pain management specialists, I see these go out the door with patients, and I wonder to myself, what's the secret there? But now I know.
Now you know.
This is fantastic. I'm wondering, since we're on the subject of posture, I've noticed my daughter at home with her posture. She's got homework, computer for a couple hours in a day, myself with posture. I'm sure a lot of patients are dealing with it. They're sitting at a computer,
Right.
They're sitting at home, they're hunched over, they're developing back pain,
Mm-hmm.
mid back pain, upper back pain. Any simple solution we might have to help correct their posture that allows them to have a more upright presentation, to not have any back pain?
Well, funny you should ask that, John. I actually personally use a product like exactly what you described. Yeah, absolutely.
Same product I described.
It's called the Figure 8 Postural Support.
Can I see
I'm
it?
actually wearing one right now.
You're wearing one right now.
Right now, John.
That's unbelievable.
So let me show
Fantastic.
everybody one of these. So this postural support, as you can see, it goes right over my shoulder and underneath my armpits. And let me turn around here. So it's fastened by a harness in the back with two Velcro pieces. And with the Velcro, when you pull the Velcro, what it's doing, John, is it's bringing back my shoulders and it's resetting them into their natural state, a neutral alignment, which is crucial, especially when you're sitting at a computer doing schoolwork or what have you all day long. So with one of these, again, just kind of bringing those shoulders back, because a lot of us tend to round those shoulders, and that creates a lot of strain and stress on the upper back muscles. So by bringing them back, it's going to, again, promote that neutral alignment. And the biggest thing is, you don't have to wear this all day. I only wear it for about an hour or two each and every day. And
Or maybe
really
just when you're at the computer,
train those muscles.
put it on, take it off when you're done with your work or
Absolutely.
Homework.
We'll play with kids.
you have this in sizes for kids too, in case there's
Yeah, we have all
fifth
all
and sixth
sizes.
graders that are having some trouble with their posture. I'm sure parents are tired of yelling at their kids to sit up straight.
Right, exactly.
Yeah, amazing. I just can't believe you actually wear one yourself. I had this idea,
Who would have thought? I was wearing it the whole
and
time.
you had it. Fantastic, Bob. Oh, by the way, my thumb feels great. I haven't even remembered, except that I'm wearing this. I don't even feel any thumb pain whatsoever. Hey, I'm thinking about that knee patient I had. I'm going to try to get him one of these Reparal knee sleeves. I think this is such a great device. But I've had a bunch of people through telemedicine that have contacted me, and a lot of it's not about, gee, I have an injury, or gee, I have this pre-existing concern. A lot of it's been, hey, I'm going out, I'm starting a little run-walk program, and I'm noticing at the end of the day, I then go up the stairs and my knee's a little bit tweaky, or my knee's a bit swollen. Nothing excessive, but they're asking for that advice, that ice, rest, Advil advice.
Mhm.
And I'm just thinking, the store's been so amazing so far. Is there anything we might have for that post-activity induced knee to prevent knee pain, or ankle to prevent ankle pain? Is there something you'd recommend that someone could easily put on that could help diminish any chance of developing any post-activity pain?
Honestly, John, this is uncanny. I once again have the perfect solution, the perfect thing.
That's fantastic.
So it's called the CoreFlex Cryo-Pneumatic Knee Ice Wrap.
Heard of this?
So this one is actually for the knee, which I'm going to demonstrate for everybody out there. But we also have ones for the shoulder, and ones for the ankle too, which are the most popular joints as far as just being able to ice down. So this knee brace here, so let me demonstrate it for you here, because this is great, especially for folks that are just looking for some kind of option just to help with the icing down of their knee, especially when they're doing activities just like what you just described. Because some folks we have call into the office saying that, hey, can I just use a frozen bag of peas?
Which you could.
You can do. It's really inconvenient. It's hard to just hold that bag right on the knee for 20 to 30 minutes for every session. So this just takes everything away and makes it so much easier. So with this right here, so you can see, it comes with this gel pack, this blue gel pack here. Now, this is something that we tell folks to stick in the freezer for at least 2 hours. It's a gel pack, so I think it's obviously staying there a lot longer. So with this particular brace, so you take this gel pack and it sticks right to the inside of the wrap. So let me get this lined up here, like so.
That was easy.
Yeah, so now when putting this on, let me stand up here. Hopefully everybody can kind of see. So with this here, it's going to go right onto my knee, like so. And it comes with 2 Velcro straps. They're going to wrap right around. Hold that in place. Here, let me get this actually going down here. So we got a Velcro strap down bottom. And we also have a Velcro strap up top. Let me get this lined up. Got a little Velcro.
And you're not as tall as I am, Bob, so you may need my knee to put that on.
We got John.
So maybe Bob will put his knee up on the chair to show you how easy this is.
Yeah, so
I can see it's easy, that's for sure. There we go.
put this up here. So with this, Velcro's all tangled up here.
That's some good Velcro, Bob. That Velcro probably will last a long time.
I want to make sure the product with the boom on it, John. So we got Velcro down bottom, Velcro up top, and then it comes with this compression pump. So as I pump this up, what it's doing is it's putting air.
I can see it expanding and compressing your knee, right?
Yeah, so not only are we getting cold from the ice pack, but we're getting the compression too. So it just really helps calm down the inflammation. All right, so that's what we're looking for. And if you want to let the air out, we can just push the button in to let the air out. We can take this hose off just so that if you need to go to the bathroom or get something.
So I see you switched to the lock there to lock the air in.
Yes.
And then when you're done, maybe 20, 25 minutes,
Mm-hmm.
you undo the lock, the air comes out, put it back in the freezer.
And that's it. Repeat the process. Generally about 2 to 3 times a day. Okay. All right, so that's a knee gel wrap, folks.
And we're talking about knees. I have some patients that have been calling. They can't get their steroid shots right now. They can't get some of the typical hands-on treatment we like to provide, but they want to be active. They still want to do their 1 mile walk during the day.
Mm-hmm.
They want to have some resemblance of normalcy. Do we have any knee brace that might be successful to help give a little more than the Reparo knee brace, something that gives a little more stability, a little more pain relief for pain management that they could employ and still go out and do their little activities?
Sure. So last week, Dr. Steer had a discussion about knee pain, knee arthritis, and ways to help manage that pain for those patients. And
That was a good video. I saw his
I
Facebook.
was actually
Live.
during his session, I was thinking about
Wait,
what brace options we could use to help folks, and it's crazy, John. I actually have the product right here. Can you believe it?
I can't believe it, Bob, that you are so prepared and knowing.
So this
Do
is
you know what the lottery numbers are for this week, Bob? Because I want
Yes.
to write them down.
I am playing Cash 5 for sure. So this is called the Rebound Wrap Hinge Knee Brace. So it's a wrap-on brace. We have different styles. We have skinny styles as well. But this wrap-around brace just kind of hold it up. I'm not actually going to put it on my knee. So it wraps right around the thigh. It wraps right around the calf. Kneecap ends up in the middle here. And there's hinges on both sides that allow the knee to bend and extend. And it comes with some Velcro straps just to kind of hold
So
it.
you get
Low profile, easy to use.
full motion, low profile. What I like here, Bob, is I do have a lot of patients that might have a tendency to not be able to lean forward, put a pull-up brace over their foot and ankle for various reasons. To have a brace that just wraps on your knee, they can do it themselves, a little bit of Velcro, and they're off. I think that's a beautiful choice. it's amazing that you had another product that I was thinking about on my mind.
It's a great option.
It's fantastic.
It's a great option. All right, so I think we have some questions, John.
Well, I just want to say one more thing, Bob.
Yeah, go
This
ahead, man.
Kabuti pillow, it's so good. I really barely have any back pain sitting here. No glute pain. If I had something for my back, for my office chair, I could probably do video telemedicine visits 12 hours straight and never even get up. Anything like that for my back?
We actually, it's funny you should ask, John. I have a brace right here.
You're killing me, Bob. I can't believe how good you are.
So
This is amazing.
So this is a back brace that we offer here at Bucks County Orthopedics. So it's a universally designed back brace. It has a rigid back panel here. So just to kind of demonstrate it for the folks out there. So this back panel goes right on my low back. What this is going to do, it's going to Velcro right along the front here. And then to really snug this up, John, is we have these pull cords on the side. So as I pull, what it's doing is it's tightening up on my back there. So as you can see, it's kind of straightening me out.
Oh yeah, that
So
was
it's
great.
really helping with my posture, and also too with the compression, it's helped calming inflammation down. And this brace actually comes with a hot cold pack, which is also nice.
Oh, that'd be fantastic.
Because just based on the patient's diagnosis, generally we recommend heat versus cold. It just depends on what's going on for that particular patient. But yeah, the hot cold pack, it's a game changer too.
And it looks like it was so easy for you to put on. Is this something that a patient on their own, they wouldn't need a second pair of hands, could put on?
Absolutely. Our wiser, more mature patients have no problem. And we make sure that they're comfortable and confident with taking the brace off as well as putting it back on prior to leaving the office. So myself as well as my colleague, we make sure everything is good prior to leaving.
I'll tell you, Bob, this has been amazing how the only thing you haven't given me is the lottery numbers. I will play the lottery because you do tell me it's my
We'll talk
lucky day.
after the show.
So we did just want to tell you that Bucks County Orthopedic Specialty Office is open for all types of visits, mainly video right now. We're doing telemedicine video visits. Our number is 215-348-7000. And we are doing telemedicine visits with our providers. We're doing them with Bob in case there's bracing questions you have. In fact, there may be a question now. If we have some time, we can possibly answer a question.
Well, actually, I'll address some of the earlier questions that had come through. So somebody asked, do insurances cover durable medical equipment? And actually they do. Just as long as you haven't gotten a same or similar product within the last year or two, generally insurances are covering it. Now you do need to keep in mind your insurance deductible as well as out-of-pocket costs, because there might be a charge just based on that deductible as well as out-of-pocket. But these are generally things that we are looking at prior to you taking the brace with you, just so you can make those informed decisions prior to leaving the office with it. So that's one question, John.
We got one here from Abby. Not sure if she's coming from the Great White North or not, Bob, but I love this question because sports medicine is my thing, and I tend to want to get people back in the game. Her question is about her husband. He sounds like some ankle instability. He repetitively injures his ankles when he's doing things, be it running, gardening. And the question is, should he wear a brace when he's working out? So Abby, my guess is you've probably told your husband he should wear a brace when he's working out. You are correct. I don't want to go against what your husband says, but you are correct. And in our DME store, we've got multiple options in bracing.
Sure do.
And it comes to mind right here, a guy that doesn't want to wear a brace, but he's going to give in, listen to his wife, who's correct. He should wear a brace. I think the double strap would be a fantastic option.
Double strap's a good one.
Thin, fits in your sneakers or your work boots. You won't even notice it's on. That might help this guy's ankle instability.
Right. Lace-up ankle brace is another good option. Just based on comfort level. If it's something that is not so comfortable for that patient, we have a collection of things that we could try just to get them back to normal.
Well done, Bob.
All right.
It's funny. We had a question before from a patient. I don't think it was a patient of our office, but they chimed in. Thanks for listening. They asked about a personal injury they have. They have an L1 compression fracture. That can be quite painful. And their question was, is that something that should get worse with time? The brace I'm wearing hurts. So can't answer that question with detail, except it depends on the brace you're wearing. So hopefully you were fit correctly. You have a brace that's comfortable. If not, there are other options out there. One can always be assessed for that. So I'm sorry your back pain is not improving, but We are happy to help you out if we can. Just give our number, 215-348-7000. Give Bucks County Orthopedics a call, and we'll try to see what's best, emergent or urgent in-person consultation, or we can do it on the phone, video conferencing, which we're doing a lot of. Any other questions you have there, Bob?
Also, too, kind of piggybacking on the back brace. It also, too, depending on what type of back brace that you are looking for, that ultimately is determined by where the problem's coming from. Because if most of your issues is coming from the low back, then typically we're going to go with a lower profile type of back brace, like I just showed.
Smaller the better, right?
Exactly. But the higher it goes up on the spine, we need to get more involved products just to help support that area. Because the biggest thing when it comes to braces is you always want to make sure that you're supporting above as well as below the injury site. If you're doing that, then you're going to help stabilize the structure, joint, what have you, and again, just get everything back to normal, which is what we're looking for. All right. So somebody did ask, John. They have bone on bone for their knee. So just that constant grinding, especially when they're going up and down stairs. And they asked what type of knee brace is appropriate for that. I can think of some things too, John.
Yeah, that's a good question, Bob. Of course, you want to see X-rays. So there's different types of bone-on-bone arthritis. It could be unicompartmental, where it's just on the inside part of your knee. We call that the medial compartment, or possibly the lateral compartment. There are specific braces. I know Bob can measure you for a custom brace. We call that an unloader brace. People who have bicompartment advanced arthritis, bone-on-bone, we have bracing for that, as well as there's just sole unicompartmental patellofemoral arthritis. So you have to be a little more defined. That's where a great X-ray comes in. That's where office visits are very important. But we even have patellofemoral braces I know that you carry in our Bucks County Orthopedics DME store that could definitely help someone, give them some stability.
Right, and then to kind of build on that, the brace, the hinge knee brace that we kind of ended with is another good option for somebody that doesn't want to go with, say, a big bulky unloader brace. This simple hinge knee brace would help some folks as well, because it gives some compression, a little bit of support. It's not a huge thing. It's an easy application. So this would be a good option too, just depending on where a person's at.
So we have a question coming in from California. Glad to know we're being reached all across the great country of the United States. And we've kind of touched on this a little bit. We've been talking about knees, but
sure.
This question raises to you, Bob.
Okay.
What's your favorite knee brace for osteoarthritis? Now, I know you and I talked prior when I had a patient. You recommended a brace, not the one we demonstrated today. It was the other style brace. If you could just elaborate for a few seconds, and we're going to close off. Although it's 11 o'clock California time, they're looking for something to do. This office might be closed.
So I think it was what, John, you and I were talking about, that hinge knee brace. A little bit more involved. It's called a global knee.
That's right, the global knee.
So it's similar to the one I just showed, but the hinges are a lot more supportive, and it has two Velcro straps, one on the thigh, one on the calf. But the thing with the global knee is that it focuses on the kneecap. What it does with the kneecap is there's some straps that help lift up. By lifting up on the kneecap, it just helps to get everything neutral, because a lot of times when it comes to the kneecap for somebody that has arthritis, is that it's just not lined up. It's not lined up in the groove of the femur bone where we want it. So by lifting up on the kneecap, it just helps alleviate the pain that's being caused by the arthritis. So if we need to get a little bit more involved with the knee brace, just based on the stages of where somebody is with their arthritis, we would suggest a brace like that and see how a patient feels walking around the office a little bit as far as trying it out.
Fantastic, Bob. Well, we have one last question, and it looks like at least someone has been interested in listening. So you do have a fan out there, Bob.
I'll get out of here.
The question is, how do I access the office during the coronavirus situation, and how do I get a brace? So if this person, maybe they don't specify knee, back, elbow, but if you're out there and you're having an issue with your elbow, and we can do a telemedicine visit with you, we can hopefully, through the computer video, give you a good, accurate diagnosis. We can then get in touch with Bob. We can, within that day, set up a way that we can meet with you, get you the brace that is orthopedically recommended for your specific orthopedic diagnosis. You do that by calling us Bucks County Orthopedic Specialists. By the way, I didn't realize I had the brace on until I just saw it in the camera.
Me too.
Fantastic choice, a thumb brace, Bob. Bucks County Orthopedic Specialists, 215-348-7000. Just give us a call. We'll set up your telemedicine appointment. We look forward to helping you out here from Doylestown, Pennsylvania. I'm Jonathan Hirsh,
I'm Bob Super.
and we are the DME guys.